chiropractor and co-owner at the Family Chiropractic and Physiotherapy Centre in Harrogate. I've been at the practice for 12 years now, just gone. Here at the centre we have a fairly unique approach in the Harrogate area in that we have a multidisciplinary team here. We have sports therapy, we have chiropractic, we have physiotherapy. We try and cover all bases essentially. What our sort of main USP from that perspective is the inter-referral between our practitioners. We've got 5 chiropractors, we have physiotherapy, we have sports therapy as I said, and we're able to chat to each other about our patients, but we also refer between ourselves. If I have a patient who's come to see me for some chiropractic work and I think they might benefit from physiotherapy, I can bring Jamie in for a second opinion. I can ask him what he thinks, I can ask him what he might be able to offer. It's all about getting you better, quicker, and more efficiently really, get you to a better functional level. We see patients right the way through the ages. I specifically work with sports patients, and that's obviously, it's very relevant when it comes to sports therapy, to physiotherapy, because you might have a patient come in and see the physiotherapist with a knee problem, for example, the sort of thing that they wouldn't automatically come to see a chiropractor about. The knee problem might be a little bit more complex, it might have some alignment issues, we might have problems either coming from the hip, the pelvis, could also be coming from the foot or the ankle. These are all things that we can manipulate. And the beauty of that is that although we do deal with the elite sports, we do deal with Premiership footballers, we do deal with professionals, we can bring that approach to the weekend warrior as well. And I'm a classic weekend warrior. I'm terrible at everything I play, but I'm just very keen. We are even more likely to come in with injuries than your standard, professional footballer. They've probably got, more training, they've got more time to get fit and healthy. Weekend warriors, we just chuck ourselves in. We're more likely to come in with the sprained ankles, the twisted knee ligaments, the strained muscles, and that multidisciplinary approach, getting you back on the pitch quicker, is great. But the beautiful thing we can do as well with that is that with chiropractic, working in unison with physiotherapy, with sports therapy, we can not only get you back to sort of getting back on the pitch as quick as possible, but we also work hard to make sure you don't end up in our office again. So often with these sort of situations, you see the patient, they get their injury sorted out, they're back on the pitch, 2 weeks later they're back in the same state again. Oh well, I was doing okay, but I rolled my ankle again. Chiropractic especially is brilliant at making sure that the patient is functioning as well as possible so that you can minimise the risk of those injuries. That's the big goal from that perspective. One of the biggest things I'm always keen on with my general patients is an understanding of the problem. When I deal with my sports patients, they tend to be very keen, they've already researched their issue. A lot of my general patients are like that as well, but the big thing I'm always trying to get my patients to understand is how this problem has arisen, what they've done to create it. Because of course, if you know what you did, you've got a much better chance of avoiding doing it again. In some cases, you crash your car, you can't get away from that one, that you didn't mean to do that in the first place, did you? But if you've got something, and the thing we see more often than not in these sort of situations are postural issues, people who spend their entire lives chained to a desk, sat in a car, it's just not what your spine's designed to do. And so I try and get the patient to understand the idea of, we're not just trying to get you back to a point where you don't have pain, we're trying to get you to a point where you can keep this thing good. You can focus on fixing that posture, you can sit up straighter when you're at the desk, you can sit in a car more correctly, and therefore you're not going to be quite so much pain, you're not going to need it on such a regular basis. This is the idea of maintenance care with chiropractic. We teach you what to do to keep yourself healthy, as well as you get you healthy when you come in initially. So if you're suffering with any of the common elements that we see in the clinic, if you're talking about spinal pain, if you're talking about joint pain elsewhere in the body, muscular issues, etc., don't hesitate to give us a call. We're always here to have a chat, even if you just want to ask us the question, could we help you? By all means, come in, have a free chat with me. We'll have a look and see what's going on, see how I can help you, or one of the rest of the team can as well. Look forward to meeting you.